It is my great honor to welcome Emma Klatman. Emma, welcome to Docday.
Thank you so much, Bastian. It's overwhelming in the best possible way.
We've heard so much about Life for a Child. Now we want to hear from Life for a Child. Most of all, tell us what you do, tell us what Life for a Child is doing, and tell us what €5 can do for children with diabetes in some of the poorest countries in the world.
Of course, Bastian, it would be the greatest honor to do so. And firstly, let me just say a big wow and hello to all of our friends within the Diabetes Online community at dedoc, Medtronic, and Lily on what feels like to me the least ordinary Sunday morning. For me, this is one of the most meaningful World Diabetes Days that I can remember in my 23 years living with type 1. I'm sure, like all of you, I've got a worm's eye view into what life is like living with diabetes in a high resource country, and I'm so aware of the privilege that comes with this. But even with access to the tools I need to survive and succeed, my own diabetes journey has been filled with contradictions, as I'm sure all of my friends can empathize with. I know you can all begin to imagine what life with diabetes is like in a place where someone doesn't have even the opportunity to begin giving themselves the care they need to survive and succeed. I've worked with Life for a Child for nearly a quarter of my life as I've lived with diabetes. And for me, what this means is that I see from above how access to diabetes care impacts young people with type 1, their parents, brothers and sisters, doctors and nurses who give all they can to ensure they simply stay safe and get the care they need. I'm sure many of you will know about Life for a Child, but for those who do not, I would like to share how we fit into the global puzzle, as it were, of access to diabetes care for young people around the world. We know that living with type 1 diabetes means having everything you need at all times, not 6 out of 7 days of the week, not half the time, and not randomly. But this is often the situation for young people who fight to live with type 1 in countries that unfortunately struggle with capacity to ensure their health systems provide all the things that type 1s need to stay safe. And here, I'm not talking about CGMs, I'm not talking about pumps or other life-enhancing technologies. I'm talking really about the basics: insulin, human insulin often, test strips, well-trained and empathetic healthcare professionals, HbA1c testing, the list goes on. But this really is where Life for a Child steps in. We exist to work with local health services, who are the hubs for young people with type 1, so that they can provide an intermediate level of care that staves off, quite frankly, disturbingly common levels of premature death and entirely avoidable complications. We work to address this challenge by building what is already there, by partnering with diabetes centers and engaging local champions, just like Sana in Pakistan. We provide partner centers with diabetes medicines and supplies. We also help with training of healthcare professionals, diabetes education, capacity building, and we support diabetes camps too. If I could, I would just love to provide a bit of granular country context, and this is in the West African country of Mali. Life for a Child has worked with the local incredible partner Santé Diabète in Mali since 2008. When we started supporting Santé Diabète, we assisted them with insulin and blood glucose test supplies. And when we started, there were roughly only 28 young people alive with diabetes. After Santé Diabète and Life for a Child began working together, that number started to rise, and quickly. And now the known number of people with type 1 is over 900. This is because of targeted education initiatives. These targeted education initiatives have helped to prevent death from misdiagnosis. They've helped to improve the levels of care they're on. This has meant that young people are actually able to thrive, and their families can go through life feeling more secure. This positive trajectory in Mali is our driving force as to why we partner and engage with local diabetes centers. As of this month, we're partnering with diabetes centers in 47 countries, which means we're supporting 27,000 young people with type 1. Our estimates and work in studying global incidence and prevalence of type 1 diabetes in young people shows us that there are many more in need of help. As Antonella brilliantly mentioned, we announced Vision 2030 earlier this year, and this means helping 150,000 young people with diabetes in 65 countries by 2030. Our goal is to accomplish this reach in the next 10 years. So our team is working hard to improve access to treatment regimens and increase provision of glucose monitoring supplies. We're also working hard to advance healthcare professional training, family education, and encourage peer support. We're also working to encourage sustainability by co-building advocacy through evidence-backed initiatives to help spur local change. We know that a better situation for young people living with type 1 diabetes in less resource countries is possible. The status quo of poor levels of access for type 1 diabetes does not and should not have to be accepted as a fact of life. We know that cost-effective interventions are possible. We know that people with type 1 deserve the chance to live full lives. And the Blue Balloon Challenge is an incredible opportunity to challenge the status quo by helping Life for a Child meet the needs of the many young people with diabetes still in need of support. I often get questions like, I would love to donate to Life for a Child to help make a difference, but I can't afford to do so. What can I do? And I usually respond saying that awareness raising in its own right goes just as far and in such authentic ways. This is exactly why we're so motivated and grateful for the Blue Balloon Challenge. One story equals one story wherever you are, whomever you are, with whatever you have. And as Bastian mentioned, for each Insta story with the Blue Balloon Challenge filter tagging Medtronic Diabetes EU, Medtronic will donate €5 to Life for a Child. These €5 will help to support a young person supported by Life for a Child for 1 month with insulin and other supplies. We would like to say a massive thank you to the dedoc, Medtronic, and Lilly communities for their contributions. We can't wait to see how our amazing friends in the diabetes online community will continue helping improve the lives of people with diabetes. This group is truly unstoppable, and you really have all helped make this the most special World Diabetes Day I've ever experienced. So thank you.
Emma, thank you again. Thank you very much for the amazing work you do. And say hello to the whole team, and we'll hear from you more, I'm sure.
Fantastic. Thank you.
Emma Klatman from Life for a Child.